Aldosterone escape is a mechanism in our body that is going to limit hypernatremia and edema from excessive aldosterone. The aldosterone is going to have numerous effects on the collecting tubules of our kidneys. It is going to act on the sodium potassium pump on the basolateral side of the principal cell. This is going to cause reabsorption of sodium and release of potassium into the principal cell. Aldosterone is also going to stimulate the potassium and the sodium channels on the apical side of the principal cell. So that is going to cause hypokalemia because we're going to be losing potassium by releasing it into the lumen. And we're going to reabsorb sodium, which is in turn can cause hypernatremia as well as hypertension and edema because remember that water is going to follow sodium. Now, aldosterone is going to have an effect on the alpha intercalated cell as well. It is going to stimulate the proton pump found on the apical side of the alpha intercalated cell. So, as a result, we're going to be excreting out protons into the lumen, and this in return is going to cause the bicarb chloride exchanger found on the basolateral side of the alpha intercalated cell to work. And in return, we're going to be alkalinizing the body as we reabsorb more bicarb. So remember that aldosterone is going to alkalinize the body, and this is a mnemonic that you can use because aldosterone and alkaline both start with Al. Now, we've discussed how aldosterone can cause an increase in sodium and water reabsorption, and then that can lead to hypertension as well as edema. Now, once we have an increase in blood pressure, our atrium can sense this and release AMP, which is a hormone that is going to cause an increase in GFR by constricting the efferent arterioles and dilating the afferent arterioles. And once we have this increase in GFR, we can excrete out sodium and water in the kidneys. And so this is ultimately going to diminish the hypertensive effects of aldosterone as well as the hypernatremic effects of aldosterone. So just to summarize, aldosterone escape is going to be a mechanism in which we're kind of countering some of the effects of aldosterone. So remember that aldosterone can cause hypertension, and this hypertension can be sensed by the atrium, which in return can cause a release of AMP, and this can increase the GFR to release sodium and water. And so this ultimately is going to diminish some of the effects of aldosterone.